Hello and welcome to the Bladder Cancer Advocacy Network's congressionally directed medical research program peer-reviewed cancer program for 2021. All participants in today's program are in listen-only mode. If you have any questions for our presenter, Dr. Amie Bunker, please enter those questions in the Q&A box at the bottom of your screen, and we'll answer as many questions as we have time for at the end of today's presentation. Today's program is really intended to provide an overview of how to apply for research funding within the 2021 congressionally directed medical research program. I welcome Dr. Amie Bunker, a science officer with the peer-reviewed cancer research program and with the congressionally directed medical research program. Dr. Bunker has been in this role for 6 years, managing grants in a variety of cancer areas, including all of the bladder cancer awards that kicked in starting fiscal year 2016. We're very thrilled to have more and more interest in those research proposals. Prior to arriving at CDMRP, Dr. Bunker was a postdoctoral fellow in a systems biology lab at the NCI, where she studied the regulation of p53 control genes and their response to different stimuli. In 2012, Dr. Bunker earned her PhD in pharmaceutical sciences from the University of Colorado Anschutz Medical Campus. Dr. Bunker, it's a pleasure to have you here. I'm going to jump off the video, but I'll be in the background if you have any questions, or if anything goes wrong with your technology, just let me know and I can pop up my screen just as easily, okay?
Sounds perfect. Thank you very much. Okay, so, you can still see my screen perfect?
We can.
Okay, good. So thank you very much, Stephanie, for that introduction. I am very excited to be speaking with everyone here today. So without further ado, I will jump right in. As she mentioned, I am a science officer for the peer-reviewed cancer research programs at CDMRP. Before I jump into what most of you are here for and learning about our funding opportunities, I really wanted to give you a little bit of perspective of who is CDMRP, what are our values, and what are we trying to accomplish through the PRCRP, the Peer-Reviewed Cancer Research Program. We fall under the Department of Defense. On this slide, I'm not going to belabor the point, but you can see our chain of command and with the congressionally directed medical research programs there at the bottom. As an office, as the CDMRP, our goal is to transform the healthcare for service members and the American public through innovative and impactful research. We do this by responsibly managing collaborative research that discovers, develops, and delivers healthcare solutions for service members, veterans, and the American public. I wanted to highlight a couple of things that I think make us at CDMRP unique as far as federal funding agencies go. For starters, we get our funding directly from Congress. So if you wanted to torture yourself and go into any given year's funding bill, you could actually find a line item for, say, the peer-reviewed cancer research program and the appropriations that we're getting that year. So we're getting our funds directly from Congress. They come to us through the DoD. We, of course, would not exist as a program without you, the researchers who are applying for our funding. And that fourth cornerstone in the top of the slide there, the consumers, that really, I think, makes us the most unique out of the other funding agencies, in that patients, caregivers, family members of people with the various conditions and injuries and diseases that are funded through the CDMRP, those people serve as active participants at every facet of our review cycle. And so it's important as applicants and future awardees of us that you really do keep those in mind, because we pay very close attention to their needs as a community. The PRCRP has existed as a program since fiscal year 09. You can see from the graph in the middle here that we've been steadily growing as a program, particularly over the last 5 or 6 years. And the Number of topic areas, as you can see on this orange line, has also continued to more or less grow over the years. As a program, our vision is to advance the mission readiness of those U.S. military members affected by cancer and to improve their quality of life by decreasing the burden of cancer on service members, their families, and the American public. Again, we do this by successfully promoting high impact research for cancer prevention, detection, treatment, quality of life, and survivorship. I mentioned that as CDMRP and PRCRP also, we get our funding directly from Congress. And that means that Congress will actually include in the funding bill each year specific language that to some degree directs us as a program as to how we are going to use our funds. And some of the highlights of that language is presented for you down at the bottom of the screen. First and foremost, we as a program are directed by Congress that we cannot use our funds to fund cancer research into breast, kidney, lung, pancreatic, prostate, ovarian cancer, or melanoma. So if your application has proposes research in any of those areas, those are grounds for us to administratively withdraw that application. There is another program that's new as of FY20. It's called the Rare Cancer Research Program. And of course, as many of you may appreciate, many of the cancers that are topic areas under PRCRP are by their definition rare cancers. So there may be an occasional overlap of one cancer being applicable to both programs. So that's getting into minutia that you don't need to concern yourselves with today. Just make sure that when you're applying for PRCRP funding that you're following the instructions in our funding opportunities. And the final point I want to draw your attention to on this slide is this box here that says research projects should be relevant to service members and their families. And if you have never applied to our funding for the PRCRP, you might not know exactly what that means. And I will give you a little bit more information here today, while also pointing you to some resources that you can look up after this webinar today and get some more information about that, what that means to us in our program. As I mentioned, Congress tells us each year which specific topic areas that we're going to be investing our appropriation in. So for FY21, we have $115 million, and Congress has given us a list of 20 topic areas that we are going to use that $115 million to fund research in. All 20 of those topic areas are listed here on the left. The topic areas in green are the ones that are new to our program for FY21. As I said on the previous slide, pay particular attention that when you are submitting an application, that it is one of these topic areas. So as this is a webinar for the Bladder Cancer Action Network, I would expect most of you wouldn't have any problem since bladder cancer is one of those topic areas. But just again, be mindful that any of the other topic areas that are prohibited, such in particular, which might be of interest to this group, particularly prostate, kidney cancer, and any of these other cancers, no funds from our program can be invested in those cancer types that are listed over here in red. And once again, relevance to service members and their families, that is a required part of each application.
So what does that? Can you just explain really quick, one quick thing, as far as all the items that were listed in red? That is really because each of them have their very own designation for funding.
Yes, I'm sorry. I did forget to mention that. So yes, the reason we are prohibited, and thank you for pointing that out. The reason we are prohibited from using our money to invest in these cancer areas is because they have their own research programs. So Congress has already designated a pot of money for breast cancer research. That's the breast cancer research program. For pancreatic cancer, there's a pancreatic cancer research program, and so on and so forth. So in Congress's interpretation, that if we were to fund anything in those topic areas, we would essentially be double dipping. So that's why those are excluded. Thank you.
Thank you for explaining. I just have one more comment, because we are the Bladder Cancer Advocacy Network, not the Action Network, but the Advocacy Network.
Sorry.
I did want, it's okay, it's completely fine. I just wanted to let our listeners know that we are actively working together with the American Urological Association to get on the red list, because that's permanent funding that enables us to stay on there. And so we are advocating, as our name says, on the Hill right now. We just sent out a whole bunch of letters for funding so that we can be designated ultimately down the road, we hope, as one of those red listed diseases. So go ahead, I'm going to stop talking now. Thank you.
Not a problem. So I've mentioned the military relevance of our applications. And so here's where I'll give you some more information about that. So to help applicants address the congressional intent for that statement, we as a program have developed 2 military health focus areas that are listed on the screen. The first one is environmental or exposure risk factors associated with cancer. So things like ionizing radiation, infectious agents, environmental carcinogens that service members may be exposed to in the line of their active duty. And then the second one is mission readiness. And what that means is to us as a program, and as we've defined it, and with the help of service member advisors to our program, is that, for example, if a service member is part of a unit that's deployed and they receive a diagnosis that they have cancer, well, they have to then leave their unit to go seek treatment. They may or may not ever return to their unit, depending on whether they're ever able to regain fitness for returning to duty. So as a consequence of that service member receiving a cancer diagnosis, they are negatively impacting the mission readiness of that unit. That unit is no longer able to function as it had when they had that member. So when we're asking you to address mission readiness, really think about how would your research eliminate or alleviate that negative impact to a unit. So this is really just a very high level, very quick introduction to these military health focus areas. I do also want to mention that every application must address at least one of these. So to help you prepare and learn more about what those mean to us as a program and how you can address them in your application, you can start by finding more information, going to the video that's listed, the link that is listed at the bottom of this slide. And that'll go into more of what these are and what they mean to us as a program. Also, when you go to the specific funding opportunities, there is a section in the program description section of the funding opportunity that lists the military health focus areas there and provides additional resources that are available on the CDMRP website, and reiterates where to find this video that's listed at the bottom of this slide. So definitely, I'll mention this again later, but this is something that is very important to our program. And if I have seen applications that if the applicants do not adequately address one of these health focus areas, then they may not get selected for funding if there is an equally comparable applicant who has given better thought, more thorough attention to these focus areas. So I encourage you to make sure that you pay attention to those. And sorry, I got low battery. My battery wasn't my cord wasn't plugged in. And I am sorry for 1 second. I
That's
apologize.
okay. That's precisely why I've got backup just in case. So take your time.
Sorry about that. Hopefully that is taken care of. So, so that was the military health. Now moving on, another item that is new to PRCRP for FY21 are the PRCRP overarching challenges. I'm not going to read through every challenge that's listed on this slide. Once again, they are listed in each funding opportunity. And you will be strongly encouraged to choose one of these 8 overarching challenges and describe how your proposal, how your application addresses at least one of these. If you choose not to select one of these overarching challenges, then you'll be required to justify why your research is still impactful. And what you can see, what I will describe, is that these overarching challenges, they align to what we refer to as a cancer care spectrum. So it starts over on the left at basic biology, etiology, understanding how does a particular cancer arise, what are the mechanisms that drive its progression, and so on. We have detection, diagnosis, prognosis. So what can we do to improve these areas for our patients? Treatment is self-explanatory. Obviously, not every cancer patient responds equally well, if at all, to the available options. So what can we do to make better treatments available to more patients? Survivorship is, again, once someone, if they are treated successfully for their cancer and they are in remission or longer, that treatment, that diagnosis still impacts their lives. So how do we do more to treat the patient as a person, not just a cancer diagnosis? And finally, resources. Almost every cancer area could benefit from better models, more repositories, etc. So what about your application might be able to contribute to the field, new resources? And before moving on into what you probably all came here about to learn more about the specific funding opportunities, just wanted to give a little snapshot of what we have done for bladder cancer. Most of you, I'm sure, can appreciate bladder cancer is the 4th most common cancer diagnosed in the VA health system. Due to the high recurrence rate and the expensive nature of the surveillance methods to track cancer patients, bladder cancer patients and survivors, it's known as one of the most, if not the most, expensive cancer to treat. And as of 2016, there were over 765,000 bladder cancer survivors in the US. So there's clearly a need for having us fund bladder cancer and having it be a topic area under the PRCRP at the least. As mentioned at the beginning of the talk, bladder cancer has been a topic area for the PRCRP since FY 2016. Since then, between FY16 and 19, we as a program have invested $23.9 million into bladder cancer research, which amounts to 39 awards. The FY20 Wards are currently undergoing negotiations, so these numbers may be subject to some variability. They're not set yet, but as of this time, we have invested $7.8 million into bladder cancer research, which is 9 awards. As part of our research as a program, we've identified some patient care gaps in bladder cancer research that are revolve around improving individualized risk stratification, trying to reduce the recurrence rates in bladder cancer patients, and then just overall improving individualized treatment selection for the bladder cancer patient community. And on the lower right-hand corner here is just a snapshot of some of the projects that we funded. The top one is Dr. Brant Inman. He received an IDEA award to look at a novel therapeutic option called Symphony. And then the lower one was a team that received a Translational Team Science Award. Dr. Mayan Omar, Dr. Shilpa Gupta, and Dr. Tae-Hoon Hwang. And they're really a truly multidisciplinary team. You see here, you have the translational scientists, the medical oncologists, and the computational biologists all coming together to work on biomarkers that can better inform clinician decisions when it comes to treating their bladder cancer patients. A little bit about our program cycle and how it works. As I mentioned, it starts with the congressional appropriation. So we get one of those every year, tells us how much we have to invest. We then move on to vision setting, which is really our investment strategy meeting. It's where we decide which funding opportunities are going to be offered, approximately how many we intend to offer, and we take a look at what our programmatic panel, and I'll get a little bit more into who makes up our programmatic panel and what they do, but they're a diverse pool of researchers that are experts in the topic areas that are funded by PRC. They're basic scientists, they're clinicians, they're consumers, so patients or survivors of the various cancers that we are funding. So they take a look at the field and identify gaps in what we can do with our investment strategy to help fill those gaps and target them. After the meeting, the funding opportunities are released. These should be coming out for FY21 any day now. At this time, you can see the pre-announcements on the CDMRP website, which will give you a snapshot of the funding opportunities that are going to be available. And again, keep that on your radar that the full funding opportunities will be coming out very soon. And then we go through a pre-application phase, peer review, programmatic review, and then the awards are go into the negotiation and active award phase. To find our funding opportunities, there are 3 locations that you can look for. We do post them on the CDMRP homepage. You'll see one of the banners that cycle through will say, in the case for now, it'll say 2021 program funding opportunities and a list of all of the programs that are currently accepting applications. You can go to the tab that says funding opportunities or the for investigators section to go find specifically what is available at that time. You can also go to ebrap.org. You will see the tab there for funding opportunities and forms. Another point of note on eBRAP is that you can go down to subscribe to email subscriptions. And so if you haven't done that already, I encourage you to do so, because then you will be notified by email when the funding opportunities for the programs that you select are available, and any other news and noteworthy items that may become available to you. And finally, you can go to grants.gov and search there. CDMRP uses a standard submission process across all of our programs. It is a two-step process. There is a pre-application phase where these are either pre-proposals or letters of intent, and I'll go into the distinction of those on the next slide. These are submitted through eBRAP. And then the second phase is the submission of the full application through grants.gov. And I want to say that the pre-application phase that is submitted to eBRAP is a requirement for all applications, whether it is a letter of intent or a pre-proposal. One of those two things are going to be required. If you do not submit a pre-application, then you will not be eligible to submit a full application. So what's the difference? If you see that a pre-proposal is a requirement of a particular funding opportunity, again, these submissions are through eBRAP. The funding opportunity will provide the specific instructions that you need to follow to submit the pre-proposal. Make sure you follow all of those instructions. They are generally preparation of a 2-page narrative. You can include proposal, bio sketches, other supporting documents as instructed. This will be reviewed by our programmatic panel. So that diverse panel of experts on various cancers that are funded through the PRC, they will go through these and they will decide which pool of these pre-proposals are going to be invited to submit full applications. This would be a great place where you're expected to address the overarching challenges that I mentioned in a few slides ago. This would be one of those places, and it's really giving them a chance to see, okay, is this project sound like it's going to address the intent of this funding opportunity? And these are required for the PRCRP's IDEA Award and for the Impact Award. And I will go into each of these specific funding opportunities over the next several slides. So that's a pre-proposal. There's also the letter of intent. Again, these are also submitted through eBRAP, and it's a letter simply saying that you're going to apply. These are not reviewed. They're only used for administrative purposes, such as helping us get an early start on selecting peer reviewer recruitment. And you do not have, oh, I'm sorry. I don't remember if I mentioned that if for the IDEA Award and the Impact Award that have the pre-proposals, you must be invited to submit a full application. If you are not invited to submit a full application, then you will not be allowed to do so. The letter of intent, there's no review, there's no need to be invited to submit a full application, but you still need to submit the letter of intent. If you don't submit the letter of intent, then you will not be able to submit a full application. The Behavioral Health Science Award, the Translational Team Science Award, and the Career Development Award. All three of these funding opportunities use a letter of intent. So, getting into what you've all been eagerly waiting for is the outline and key points of the FY21 PRCRP funding opportunities. The first of these is the IDEA Award. These are eligible, are open to all faculty, all researchers with a faculty level appointment. These are supposed to be innovative, high risk, high gain reward research. The emphasis, as it says here, is really on innovation. This is not meant to be a continuity of research type of proposal. You do not have to include preliminary data, but if you do include preliminary data in your application, then it is fair game for peer reviewers to critique it. For this year, the IDEA Award is going to be $500,000 for up to 3 years. And, excuse me. And the key points for these, again, is what is the innovation? What is novel? What are you testing? Convince the panel, the peer reviewers and the programmatic panel, that this is something that, if successful, would be impactful. This should not be an incremental advance or a next logical step of your research. And again, pay attention to the overarching challenges and making sure that you're addressing those in your application. As I touched on before, and this will come up a few more times, is that don't phone in the military health focus areas. Really pay attention to those. Then the next is the Impact Award. This is for assistant professors or above. And this is, as the name of the funding opportunity implies, something that really, if successful again, is going to have a major impact on the field. And so funds for this award can be used for clinical trial costs. You are required to provide preliminary data. And the direct cost for this program, for this funding opportunity, is $1.25 million over the course of 3 years. To be successful applicants for this funding opportunity, you really want to be clear and tell the reviewers why this proposal is going to be impactful. By near term, we're talking about within 5 years. What is this research going to do for our patient community? Again, make sure you're addressing one of the overarching challenges. And this really is meant to be a continuity of research. And at the end of part of the application is a research outcomes plan. So you're telling us your vision for this project. When this project is complete, this is how you see the next steps progressing. So if it is supposed to be preclinical work testing efficacy, toxicity, et cetera, of a novel therapeutic target or novel therapeutic, how are you going to then advance it once this award is done to the next level? Show us that you have a plan for where you're going with this project. And what's your plan, and why is this research distinct? The next one is the Translational Team Science Award. Eligible applicants are at the assistant professor level or above. And this is really to fund at least 2, but no more than 3 partners. It's hypothesis-driven correlative research. And those correlative research of an either completed or currently ongoing clinical trial. You can use funds from this award to support a clinical trial. However, that's not the intent of what we're trying to accomplish with this. It's really, you have a clinical trial study, you have a pool of specimens, and you're trying to understand why some people responded to the therapy and why others didn't. Something of that nature or similar. Again, you must provide preliminary data, and the direct costs for FY21 are going to be $2.5 million across all 2 to 3 partners over 4 years. Again, collaboration is one of the key points of emphasis for this project. So clearly show how each partner is intellectually involved in the project. This is not meant to be a partnership between a translational scientist and a clinician, where the clinician is only providing samples and that's it. We want to see where the clinician's involved in the design, the analysis, the interpretation, and then advancing the outcomes forward. So really show how it's a partnership, not just my neighbor is giving me samples from down the hall. And again, as the name of the funding opportunity implies, we want to see the translation. So you have a clinical trial, you're bringing ideas back to the bench, and how are those going to then be translated back to the clinic? Be mindful about including one of the overarching challenges again, and the Translational Team Science Award also requires a research outcomes plan as part of the proposal. So again, if this project is complete, where do you see the next steps going and how are you going to get there? And then the last funding opportunity that I'm going to speak to is the Behavioral Health Science Award. And this is, this was new in FY20, and they are for independent investigators with faculty level appointment or equivalent, supporting innovative research, and are really addressing the 3 stages of survivorship, which are listed on the lower right-hand corner of the slide. So acute survivorship from the diagnosis to the end of initial treatment, extended survivorship, so after treatment, helping address the patient needs, and then permanent survivorship. So again, a lot of cancer treatments can have long-term impact on the patient. What are we doing to help those patients improving their quality of life? This mechanism also does support pilot clinical trial concepts. Only 3 of those 8 overarching challenges are applicable to this funding opportunity. If you don't select one of those 3 overarching challenges, then again, you'll be required to justify why the proposal is still fitting an area of need. And this funding opportunity is $1 million over 4 years. In addition to impacts and overarching challenges in addressing the stages of survivorship, a unique feature of this funding opportunity compared to the other ones I've talked about today is that patient advocates must be involved in the application itself, in creating the application, but also in the execution of the project. So this is described in more detail in the funding opportunity. So read through that and make sure you understand the intent of that. Again, as I mentioned at the beginning of this talk, we really do take as a program and as an CDMRP, the perspective of the consumers very seriously. And so when you're submitting an application, please be sure that you're including patient advocates that they're advocates for survivors of the cancer that's being studied.
Amie, can I just interject for 1 second?
For
those of you who are interested in the Behavioral Health Science Award, perhaps you have your own group of patient advocates that you have worked with in the past, but if you would like, please approach me, Stephanie Chisholm, the Director of Education and Research at Beacon, because we have a whole group of patient advocates that have been trained and are very eager to get involved in the research process. And depending on what you're studying, there may well be some people within this group that I can help you connect with to be patient advocates, to be involved in the development or implementation of your trial. So if you don't have patients on your own, certainly we can help try to coordinate that for you. So please let me know.
Thank you. And while you were talking, Stephanie, I realized that I did actually leave a funding opportunity out of my presentation. So there is one more. It is our Career Development Award, the Fellow option. And so that you can find out more information about that by visiting the PRCRP webpage, and you can find it listed with the other pre-announcement information. So my apologies for that, but if you are an early career investigator, please do go seek that funding opportunity out. and find out more about it from our webpage. And then the next few slides are really just going to speak to reading our funding opportunities and understanding where to find the most important information. Obviously, they are their documents, they're technical in nature, so they're long, and they're not every section's the most exciting read. But I can't emphasize enough that the most important thing that I hope you take away from this next section is to please read all of the words from both the program announcement and the accompanying general application instructions. These are updated every year, so make sure you're looking at the appropriate funding opportunity for the appropriate fiscal year. So we're talking about the FY21 fiscal year. And on the cover of the first page of each program announcement, funding opportunity, you will see the name of that particular announcement. So this one is the cover page for a Behavioral Health Science Award. And very important, listed right there on page 1, are all of the submission and review dates. The submission deadlines are, for all intents and purposes, final. There are very few occasions when those dates would be pushed back. So pay attention to them, add calendar invites or calendar warnings, whatever you need to do. These deadlines are important. So the first tier of review that we have is peer review. And this is technical, merit-based part of our review process. The peer reviewers are both scientific peer reviewers, so either basic science researchers, clinicians, etc. They are, again, we do have consumer reviewers. So on the bladder cancer panel, we're going to have bladder cancer consumers. We don't have standing panels, so we do have 50 to 60% turnover every year. And they're based on their expertise and the needs of the program. And you as an applicant will not know their identities, and you're not allowed to have any interaction between the peer reviewer and yourself as an applicant. These peer review, as we like to say, you're not being compared to any other applicants. Your application is being compared to a gold standard, so to speak. And the outcome of peer review are summary statements. So I'll go through some of example of peer review criteria on the next slide, but in each funding opportunity, you will learn, the funding opportunity describes which criteria are scored criteria and which are unscored criteria. And so you should be making sure to speak to each of those different criteria that are spelled out in the funding opportunity. And the summary statement will summarize the reviewer's comments broken down by each of those criteria areas. And really, the thing to keep in mind at this part is that you're writing to the peer reviewers, not just to the scientists. Not just to the science, excuse me. So here on this slide is an example of peer review criteria that could be used for to judge a research strategy and feasibility section of an application. And you really want to think of this as a scoring rubric. So read each of these criteria points carefully and make sure that your application addresses each one of these points. And so the score that you get for research strategy and feasibility is going to be based on how well you address each of these points. And just kind of, I'll reiterate this in a second, but one of the things to keep in mind as you're addressing the criteria and developing your proposal is to keep to try to reduce the jargon and make sure that someone who's not an expert in your specific field will be able to understand the concepts that you're conveying when you're addressing each of these peer review criteria. Then all of our applications go through a second tier of review called programmatic review. And so again, this is a diverse panel for peer review. You have programmatic panel members that are experts in colorectal cancer, bladder cancer, mesothelioma, and so on and so forth across all of our funded topic areas. And so this part of review is a comparison-based review. So the summary statement of your project being compared to the summary statement of another project. And this is where it's going to be very important that you have a good military health relevance statement. And so that's going to be one of the things that the programmatic reviewers are looking at closely. I've seen projects that they may have scored very well in peer review and they hit all of the science notes perfect. Well, maybe not perfect, no one's perfect, but they hit all of the notes and got a good peer review score, but they phoned in or didn't adequately address those military health focus areas, where another high scoring proposal did do that. And so there's only so much funding to go around. And so they're going to factor that into their decision making. As part of some of these applications, you may be told to submit an innovation statement or an impact statement or something of one of those types of things. And so that is also something that the programmatic panel members will take into consideration at this point. So how well are you making the case that your project, if it's an IDEA award, how innovative is it? If it's an impact award, how well did you make that case in your impact statement? And so the outcome of programmatic review is a list of funding recommendations, a list of projects that are recommended for funding. And getting down to the end here, a few strategies for success is plan ahead. As I mentioned a few slides ago, these deadlines are important. So plan ahead, plan accordingly, give yourself time to read the funding opportunities well in advance. If you're applying, because if you're applying for the Behavioral Health Science Award, you might need time to find appropriate consumer advocates to incorporate into your research. So that may take time if you've never done something like that before. If you're applying for a Translational Team Science Award, maybe you'd like to propose a new collaboration with someone you haven't worked with before. So you're going to need time to get that fleshed out and the appropriate letters and things of that nature into place. So planning is important. Grantsmanship, I touched on this a little bit, really making sure that you state your idea up front and then support it. Be clear. Again, you have consumers, they're not reviewing the science for our proposals, but they are looking at those other statements. They're looking at the abstracts. They're looking at the military health focus areas. So really make sure that you're reaching out to, particularly in those areas, that you're reaching out and making the argument for why your application is hitting the needs of that funding opportunity. Again, intent of the mechanism, read the award information sections closely, because that's where we're telling you what we're looking for. Read through all of the peer and programmatic review criteria, because we're telling you what we're looking for and how we're scoring. Address the impact. Again, we want cool science, we want good science, but it has to be important, impactful science also. And of course, feasibility. Ideas are great, but show us that you have the expertise and the team necessary to carry them out. Some pitfalls to avoid. This is very, very important. Do not include current programmatic panel members in your application. You can find the list of current panel members on the PRCRP website. Do not exceed page limits. Make sure you convert everything to a PDF and look through it before submitting it. Don't miss the submission deadlines. And make sure that you submit the correct project narrative and the correct budget. Once those are submitted and the deadline is passed, those cannot be modified during the verification period in EBRAP. So be very careful with those. For the FY21 PRCRP timelines, I'm not going to read all of these here. You're going to have the slides. So pay attention to those. Pay attention to, again, whether you're applying to an IDEA award or an impact award and you have to submit a pre-proposal, or if you're applying to the other mechanisms that only require a letter of intent and the deadlines that are associated with each of those items. And finally, please visit the PRCRP website. You can find information again about funding opportunities. You can see lists of recently funded investigators. We have what's called information papers that give you some statistics about submission and application and funding rates from the previous fiscal year. So please, I encourage you to check out our websites. That go through the CDMRP website as well. There's other useful information there. And finally, I'll point out before giving you a chance to ask some questions, is we do have a webinar series that encapsulates some of what I've discussed today, again, about tips and tricks for applying to CDMRP funding opportunities. So some of the information that I presented today would be reiterated in some of those webinars, but they again could be useful tools for you. So without any further ado, I will open the floor up for questions.
Thank you so much, Dr. Bunker. This was wonderful, and I hope a great resource for everybody that is listening in. And remember that we will be posting a transcript as well as Dr. Bunker's slides and make all of those available to you. You'll also have access to the recording of today's program if you want to listen to it again. So we've had a couple of questions come in. First, can Impact Award have more than one PI?
They cannot have more than one named PI. You can have collaborators, you can have co-investigators that are listed in the budget, but they would not be a named PI on the award, not like the translational team science.
Mm-hmm. Thank you. Okay. Typically, I'm sure you get a lot of proposals. What is the general percentage of proposals that make it through the programmatic review that eventually get funded?
So that varies. PRC is, again, a complex program. So what our programmatic panel tries to accomplish is make sure that we fund an appropriate number of, that's not the right way to say that. We want to make sure that we fund across all of our topic areas. And then we also want to try to fund as much as we can across all of the different funding opportunities. But those are really going to depend on the number of applications that we receive. So some years we might have a huge number of bladder cancer applications and maybe only a few mesothelioma. And so there's not one clear percentage that we're like, okay, across the board, it's X percent of applications. So we have a lot of factors that we take into consideration. And so that's why I mentioned the information paper. So in the information paper, we break down how many applications we received for each funding opportunity and how many were funded, and then also how many applications we received for each topic area and how many of those were funded. So I encourage people to go to the PRCRP website and you'll be able to see those numbers. Last I checked, FY19 was still posted, but the FY20 numbers should be available soon.
That was my next question. When are the fiscal year 20 awardees going to be announced, and how will we find out how many people did apply for fiscal
And
year 20.
so if you go to the PRCRP website, I just talked to Donna about this yesterday or the day before, and so she was working on it, so it should be very soon. And anything that's listed on the website for FY20, they are currently, all the FY20 applications are still under the negotiation process. So there is a small chance that there might be, that list isn't 100% set yet, but it's going to be pretty accurate. Not too much is going to change between now and when negotiations are finalized.
Okay. One quick question, and then I'm going to ask another bigger question. If somebody were to apply for one of your grants, and in the meantime, something else came through that funded a portion or most of what they were proposing to CDMRP, does that preclude them from accepting CDMRP funds, or is that something they can expand their proposal once it's in some capacity to allow for that?
That's dealt with on a case-by-case basis. It really depends on how much overlap there is. In some cases, maybe we could work with the investigator and say, okay, well, we'll remove this portion of the proposal and still fund this portion, but we don't allow for changes to the core of the science, because that's been peer reviewed. It went through programmatic review. So that's what our panelists recommended for funding, was a proposal as reviewed. And so we don't really allow too much changes. Like I said, we'll try to salvage something if we can, but we really encourage people that if they do submit because we know the funding levels, we know what challenge it is, and that it's not uncommon that similar or identical applications will be submitted to different locations. So it just might be something that if both are funded, the investigator might just have to be prepared to choose one or the other.
That's probably what happens in that negotiation period at the end, right?
That is one of the biggest things that we're looking at.
Decisions and commitments. Okay, great. And then I have one big question. Can you clarify the difference between the IDEA and the impact awards?
Certainly. So I'll just go back real quick. So the IDEA award, the main feature, if you're going to remember one thing about the IDEA award, is innovation. What's new? We don't expect there to be preliminary data. If it's a high risk, high reward, it's it's only 500,000 for 3 years. So really you're trying to collect some preliminary data to support a larger application for something like an R01 or an impact award. So we don't expect you to come to the table with much other than a well-justified idea, since IDEA award. The impact award, sorry, one other thing kind of on the flip side of that is if something seems too developed, if someone's submitting an IDEA award and say they have a lot of data and it sounds like a good idea, but it's clearly just a continuation of ongoing research, that's a detriment to them actually, because that's not meeting the intent of what we're looking for. And so that's the main thing for an IDEA award. Versus the impact award, this is something where preliminary data is required. We are expecting this to be not high risk, but have a high probability of success. So you just need, the investigator just needs the funding to, work out the ideas, build up the infrastructure, or build up, the data to support, say, moving to a clinical trial. That's really what we're trying to accomplish there, is bridging that gap and moving an idea that will impact patients in the near term, moving that forward. And hence, that's why it's a larger award, the 1.5 million over 3 years.
Great. We have time for one last question. Are there any different considerations if applying from an institution in Canada versus the United States as far as eligibility for programming?
No, we have several applications that are applicants who are from Canada and Spain and Australia.
Okay, so you do accept international applications?
We do.
Okay. Is clinical trial support allowed using the IDEA award?
No, it is not. So only the impact award, the translational team science, and the behavioral health sciences can be used to support clinical trial costs. The IDEA award and the career development award do not support clinical trial costs.
Thank you. Well, Dr. Bunker, I want to thank you so much. This has been a very informative hour. Remember that we will be putting this recording up and you will have access to it very shortly. And also there is a quick evaluation. We'd love for you to give us your input on today's program. And we hope to see you, Dr. Bunker, next year, where we might even make it as a line item. That's what we're really hoping to have. Even if we have to keep doing this for the next couple of years, you know, we'd love to see bladder cancer get the attention that it's due. It was wonderful to have all of you on today's webinar, and I'd like to thank you, and I'm going to go ahead and end the program. Thanks so much.
Thank you for having me.
Bye-bye.
Bye.